Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about pseudohyponatremia. What is pseudohyponatremia? That is false low sodium. Normal serum sodium level is 135 to 145 milliequivalent per liter, or it is in millimole per liter, and you call it as hyponatremia when the serum sodium drops less than 135. So what is pseudohyponatremia? When the serum sodium is less than 135 and in the presence of normal or high serum osmolality. Normal serum osmolality is 275 to 295. Osmolality means the concentration of the plasma. When the serum sodium drops, the concentration should drop. But when you do a lab test and you see a serum sodium less than 135, but at the same time the concentration remains normal or high, that means it is a false hyponatremia or pseudohyponatremia. Now let's see what are the causes of this pseudohyponatremia. When there is hyperproteinemia, increased protein levels, usually greater than 10 gram per deciliter. Normal serum protein is 6 to 8 gram. It is usually seen in multiple myeloma or the effects of immunoglobulin therapy. Second cause can be hypertriglyceridemia, increased triglyceride level, usually above 1000 milligram per deciliter. Normal triglyceride level is less than 150. Third cause can be hypercholesterolemia, increased cholesterol level. Total cholesterol level should be less than 200, and this is usually seen in obstructive jaundice. These are the three main causes associated with pseudohyponatremia. It's also seen in hyperglycemia as the blood glucose increases beyond 400 milligram per deciliter. So remember, in this condition, lab may measure low sodium and it's just a lab measurement error. So it's called the pseudohyponatremia. Now what causes this lab measurement error? So when a blood sample is sent to the lab, so this is the blood cells and this is the plasma volume. What lab reports is sodium, amount of sodium in plasma water. But actually the lab equipment measures is sodium in plasma volume. So if you look at the plasma water and plasma volume has other contents like proteins, lipids, etc. This plasma water and plasma volume are almost same, just off by maybe 10%. So this is what lab measures and they correct it and reports it. But what happens if there's a significant increase in proteins and lipids? So you can see the plasma water and plasma volume are not same in this condition. And what lab measures is sodium in plasma volume, which is significantly high than plasma water. So remember, the plasma volume is significantly high. The denominator is much higher than actually what should report the plasma water. And as a result, if the denominator is high, when the lab measures, the sodium reads low and it will report as a false hyponatremia. So today we learned about pseudohyponatremia, and thanks for watching my video.